You're welcome to Reproductive Health segment with Dr. Ajayi. My name is Dr. Abayomi Ajayi, and today I have a very special program for you. We are back in the laboratory. You know, last week we were discussing male factor infertility, and I said we're going to the lab. So we are back in the lab today, and we're going to be talking male infertility. To discuss this with me is Remy Ogundepo. Remy is the Chief Embryologist, Nordica Fertility Center. Remy, it's so good to have you on the program.
You're welcome, sir.
Yeah, very good. Today we're going to be talking about, we hear low sperm count. What is low sperm count, Remy?
Well, as the name implies, the count is below a certain level. Now, globally, by WHO standard, it has to be 20 million. And formerly, the percentage motility used to be 50%, but now it has even gone down to about 30%. Okay. So anything now below this level is usually regarded as low sperm count.
But there is another one that they say is no sperm count. Is that possible?
Yes, it's possible.
Okay.
And it could be of two types.
Yeah.
It could be that the man is producing but it's not coming out. That is, he's not directly ejaculating them into the semen, or the man is not even producing at all. In which case, there's testicular shutdown or failure.
Good. So this program we're going to be looking at, I see some things moving, and I hope the camera can catch this. There's some things moving around the whole place. What is this? What is this that can the camera catch it?
Well,
what is this?
Well, I have a demonstration of the sperms
Yeah.
on the monitor.
Okay.
They are just the sperms swimming about freely.
So all these things swimming about are the sperm cells?
Yes, they are sperm cells.
Can you just tell us, is this a good sample or is it a bad sample?
This is a fairly good sample from a man.
Why do you say so?
Because the count is more than 20 million.
Okay, so you can tell, even looking at it this way.
Yes.
This is how you do your sperm count?
Well, there's a special way that we do it. There's a special chamber for counting it, and that chamber is what we use to count it. We just load the chamber with a precisely accurate volume, after which we allowed it to just settle a bit so that the sperm cells, they move freely about them before we do the counting.
Okay. I know that when sperm count is very low, what you guys do is to do ICSI.
Yes.
Which ICSI is intracytoplasmic sperm injection.
Yes, sir.
For this, what you do, we're just, for the sake of the viewers, is to take a sperm cell and inject it into an egg. Do you want to show us how you do this? Do you want to show us how you do this ICSI?
Yes, we have it. I have on demonstration here an egg that is about to be injected.
Okay.
And this is, I'm going to show you now.
Yeah.
What I'm trying to do now is just to pick up the egg. I'll pick up the egg.
Yeah.
And after picking up the egg, I'll inject it. Then you can see it directly on the monitor.
Okay.
Well, before picking up the egg, I would have selected a sperm cell for it. So I already done that.
You've already done that?
Yes, I already done that. So I'm now bringing my needle down. Everything can be seen on the monitor. So I have, in view now is the egg about to be injected.
Okay, so that's the needle we are seeing approaching there.
So this is the needle bearing the sperm. The sperm cell is there.
Good.
And I'm going in.
Oh, wonderful.
Yeah.
Okay.
So
you've injected this sperm.
Yes, I've injected the sperm now. So I'm withdrawing
your needle.
My needle.
Wonderful. That's it. That's it. Good. So, ladies and gentlemen, you've just seen what ICSI is. It's all about. It's injecting a sperm into an egg. Yes. This is done under a lot of magnification. It's not as simple as it looks anyway.
Yes.
Now, one other thing I want us to talk about on this program today is this issue of retrograde ejaculation or dry orgasm. People talk about retrograde ejaculation. This is a condition where the man is putting the sperm into the bladder rather than it coming out through the urethra. The urethra is the opening in the penile shaft.
Oh, yes.
Yeah, good. Now, what are the causes of, I'll just say a few things about retrograde ejaculation. I know you do ICSI for this as well sometimes.
Yes.
But let's just, some of the causes of retrograde ejaculation is people who are on some drugs for BP, and also even benign prostatic hyperplasia or enlargement. People after surgery, especially this very good surgery for prostatic enlargement now, which we call TURP, or transurethral resection of the prostate. And then some spinal cord injuries also can give you retrograde ejaculation. And diabetes mellitus can also give retrograde ejaculation. And the way to diagnose retrograde ejaculation actually is by doing a urinalysis, examine the urine analysis, the urine sample after masturbation or sexual intercourse.
Yes.
So this is now, you see a lot of sperm cells in the urine. You are not supposed to see a lot of sperm cells. You see a lot of, and that gives it away. Now, the treatment will include drugs. Very few people can be cured with drugs. Surgery can also help, but most of the time they end up with REMI, and he has to do this sperm preparation, and then sometimes they have to do ICSI. Now, is there any particular preparation that you do for these sperm samples that are being assaulted, if you like me to use that language, by urine?
Yes, because urine, normally sperm cells are not supposed to be in urine, because urine is not the medium for them.
Okay.
What urine does to them is that it kills them off.
Good.
But before a man with a history of retrograde ejaculation is allowed to produce sperm cells, semen, what we do is just to make sure that there are various ways by which we can get pure sperm cells from them for treatment. Now, when one is to make him infuse sperm prep medium into his bladder.
Okay.
That's one way. Another way is just to mellow down or temper down the pH of the urine, which is most of the time that is what kills off the sperm cells.
Okay.
It might be by giving them
sodium bicarbonate.
Sodium bicarbonate, Epsom salt in form of Epsom salt.
Yeah.
And another one is that immediately after they have produced the semen, which is always very, very little in quantity. Mm-hmm. We just dilute them. We give them medium in semen bottles, and now ask them to go and produce this urine immediately after ejaculation into the
where
bottle,
you have a comfortable environment,
so that the medium will mellow down or temper down the condition of the urine, which is always very injurious to the sperm cells. Okay,
from your experience, how do you think these people should be treated? Is it intrauterine insemination or ICSI?
The best form of treatment for them is by ICSI.
Is by ICSI. So
yes.
Because some of these sperm cells, like you said, have been exposed to very hostile environment.
Yes.
The function is not very good again.
Yes.
And therefore, the best way to treat them is to inject the sperm into the egg.
Eggs directly, yes.
Very good. It's been very good having you on the program. I'm sure we'll come back to your territory again very soon.
Thank you very much, sir.
Thank you very much for listening. It's been wonderful having Mr. Ogundepo with us, and I'm sure we'll have him again. So keep watching, and then we'll see you next week. Thank you.